Hey guys, welcome to A Simple Aesthetics. I'm Dr. Abraham and I'm here with Lindsey today, who's been with us a few times.
Yes, so happy to be back.
Always a pleasure to have you. We have an interesting topic today. We are talking about, we're an aesthetic podcast and we talk a lot about things you can do externally, to feel better and look better. But we're going to be talking about more the internal side today. And even here at our med spa, we do offer services that are kind of more systemic, more internal, to kind of help you look and feel your best.
Yes. Yep. And actually, people feel very good when they're doing their aesthetic treatments like Botox. And there's been a couple studies now that show kind of like an internal decrease in like depressive kind of symptoms or overall happiness. And it shows that people that get Botox generally feel, or there's a significant amount of people that feel less depressed and more happy. And some studies say it's because they're not actually performing the like frown motion and sending that signal to the brain. And some say that it's because they just feel overall better about their appearance. But I love that because people really do feel better when they're taking care of their skin and doing this self-care. And then truly internally, we have options to kind of maximize their metabolism, help with their kind of hormone balance, or chronic inflammation, chronic like weight control problems. And so we have all kinds of things that we offer in the med spa too, more for like wellness type of treatments.
Absolutely, and just cleansing and detoxing your system can have its effects on your whole body, including your skin, including how you look and appear and feel. And I love what you've said about the Botox there. I mean, to me, it makes sense because it's kind of like that cycle where kind of what we do externally kind of affects our inside and vice versa. So we want to form that like positive cycle of like positive emotions.
Yeah.
What are some of your favorite treatments that you've done, whether on yourself or on your clients, that are kind of more like internal, if you will?
Yep. So we do a lot of kind of like weight management treatments, some with GLP-1 treatments, but also some just with kind of like vitamin supplements. So I love doing personally B12 and glutathione shots. B12 is basically a B vitamin that gives energy or fuels to your cells so that they can function at the optimal level. So it kind of fuels the cell, and your cell function decreases a little bit over time just from oxidation, aging, lower levels of B12, gut inflammation, all kinds of reasons. But the B12 kind of allows your gut to absorb iron, produce more red blood cells. It helps fuel all the cells in its pathway, and it helps overall cell metabolism, which can help with weight loss and just energy so that you don't feel so drained, on a weekly basis. You could basically do these weekly. People that have certain conditions have to have the injections of B12, or you can supplement them, but the injections absorb so nicely. And if you're feeling run down or you just want to like kickstart your metabolism, it's an easy option. And then glutathione is one of my favorites. It's a super powerful antioxidant that helps kind of overall anti-aging, but really helps kind of rejuvenate the liver, which has all kinds of different benefits for the body. So those two are some of my favorites. But for general patients that come in, I recommend a lot of NAD therapy, which I love. Sometimes IV treatments based on if they're recovering from something, want a boost of metabolism, are going to be traveling, feel fatigued, were recently sick. Those can just kind of infuse hydration and vitamins. And then we have some others, but what are your favorites?
No, I love that. Some of the stuff you've talked about. Glutathione is definitely one of my favorite things to do, and that one can be done as an IV or as an intramuscular injection. I love the IV, but I do like that the intramuscular injection is easier to do. So I personally make sure I do glutathione shot like every couple of weeks on myself, just because I love the antioxidant effects that glutathione can bring. And you've already talked about a bunch of those. So
Mhm.
glutathione is definitely something that's also very popular. We have a lot of people who come in and ask about glutathione
Mhm.
infusions, injections, and that is one of my favorites. NAD might be my absolute favorite.
Yeah.
NAD plus is something that I've been doing for a long time. It's recently been gaining a lot more popularity, and I love that because I do think it can be a very powerful tool
Yeah.
that we have. It has a lot of like benefits in terms of neuroregenerative benefits and even anti-aging benefits. And there's a lot of like supplements nowadays that try to boost your NAD levels and stuff. But to me, if you can just you know supplement, like give yourself NAD,
Mhm.
especially through an IV, where it's just going directly to your system, I think that's probably the best way to increase your the NAD levels in your blood. Because when you're
Mhm.
doing the supplements, you're basically taking these precursors and stuff in the hopes that some of it is gonna cause an increase in NAD in your blood. But if you can, sometimes if you can just give that molecule directly in the
Yeah.
blood, you're bypassing a lot of that system. So that is definitely one of my favorites as well.
I love NAD. And yeah, there's like all this kind of research on the oral supplements, but they don't find that it absorbs great through either pill form. Some sublinguals absorb better, but the dosing is so low on the oral pills or supplements that it's hard to get kind of like a therapeutic effect from it. And all the studies are based on IV because you can get such a high dosing that that's where they see a lot of the
Mm.
changes happen, and then you can maintain with your supplements at home or just like lighter dosing injections in the
Gotcha. Interesting.
office.
That's very
Uh-huh.
interesting.
Yeah, NAD I've seen work sometimes in conjunction with stem cell therapy too. And it's just such an exciting direction that we're leaning into. Although there's not a lot of FDA approval or big studies to back it. So it's a little bit controversial in terms of like big pharma. But definitely it's gaining popularity, and I've seen so many people benefit from it with depression, chronic pain, hormone imbalance, infertility, chronic fatigue. And there's many small studies that prove such benefits from it, small studies on rats as well. And then hopefully the FDA will kind of allow bigger studies so that it can be more widely accepted.
Yeah, I mean, definitely a lot of time with the kind of newer technologies and newer things, it can take some time for us to kind of get all the studies that, the larger studies, as you mentioned. There's a number of studies on NAD. It's not completely like, an unstudied molecule, but there's definitely room for more and more. And I think that's going to happen a lot more in the future.
Mhm.
And I've also mentioned IV vitamin therapy, and there's another thing too that is also gaining a lot more popularity. It's been around for a long time, but recently, a lot of that popularity is coming from also word of mouth, where people are trying it and they're kind of seeing the benefits for themselves, and then they're talking more and more about it to their friends.
Mhm.
But the nice thing about the IV vitamins is usually, it's a cocktail of like different vitamins, whether it's like, vitamin C is a very popular one, the B vitamins, sometimes, magnesium, calcium, some of the other things that can be in it, including antioxidant and other stuff that can be done as an IV. It just makes a great cocktail
Yes.
to kind of nourish your body with these vitamins and kind of give yourself like these high doses of vitamins, because
Mhm.
some studies like with vitamin C, for example, shows that there are certain effects that you're going to get these high doses that you might not get with like
Yeah.
lower doses.
Yep, pigment correction, skin improvement, obviously antioxidation, which there's so many like chronic illnesses that can occur just from chronic fatigue on the body, chronic stress, and the cells are just stressed so much that if you can provide nutrition basically back to the body or coenzymes, which is the NAD, so that the cell function kind of rejuvenates a little bit, your ability to fight diseases, your ability to recover, your sleep, your brain function can just be optimized using some of these supplementations that so far don't show major risks whatsoever. So they're such great options.
I think also having good products like supplements, obviously all of that is in addition to living a healthy lifestyle, right? So we always want to start with that, doing, staying active, exercising, eating the right food. That should be kind of the basis. That's kind of at the baseline. So you want to do the best you can with that stuff. There are certain supplements that can also be tailored to the patient's needs. So, like, whether it's somebody, let's say, suffering from hair loss, that we have certain supplements that we might be able to recommend that can like target that specific concern, or if it's a different concern, we might be able to address it differently. As you've mentioned, given keeping your hormones balanced can be very, very important. So I think starting with a healthy lifestyle, avoiding too much too much alcohol, cigarettes, a lot of the things that can damage your skin. Doing the healthy diet, staying active, but on top of that, if you can supplement that with some of the stuff that we've talked about, whether it's like IVs or something like glutathione, which is a powerful antioxidant,
Hmm.
different cocktails of vitamins, whether it's injections or IVs or NAD therapy, which is again one of my favorites. Then you can just kind of really start to optimize your function more and more.
Yes. And whenever people come in for their Botox treatments, you can always pretty quickly, especially if it's just a shot of glutathione and B12, add that on. That often occurs. And it's so easy to do while you're in the office. If you need an IV too, really, it's like a 20-minute procedure, for the patient, but for the injector, they can just basically mix the IV and have them do it just while they're at their appointment. So they can either do it on the spot, or if they're doing NAD, sometimes they have to schedule it. But it's a fairly easy add on just to kind of treat the whole person, and is
Inside and
just,
out.
yeah, and it's just a little different approach compared to a lot of like, medications that people take. You can just kind of supplement the body with the nutrients that it needs to function. So it works
Awesome.
really well.
Yeah, and honestly, I personally anticipate that these types of treatment to become more and more popular with time, just
Mhm.
kind of based on what I've seen and how people feel with them. So, and I think in general, just a lot more people now are asking about things that they can do that are more, rejuvenation, regenerative, staying ahead. Like people don't want to wait until, they're really sick and then kind of
Mhm.
going after medication. A lot more people are trying to be more proactive
Yeah.
about their health. And I
Mhm.
think it's a very positive thing.
Yep, and they're just very, hardworking people usually that we see really stressed, have families, have jobs, both, all people in their family work, and so it's just a way to help the body kind of recover sometimes from all the crazy stress in life, and so it definitely helps, and it's pretty much indicated for your everyday patient that walks in. So
Awesome.
mhm.
Well, thank you guys for joining us. Hopefully, you found that helpful. Make sure you like and subscribe. And if you have any questions or any topic that you want us to discuss, you can leave us a comment or send us a message. And we'll definitely talk about it in one of the next episodes. Come back next week for our next episode and have a great week.
And give us 5 stars.
Absolutely.